So it seems as though the most common exercise for shoulder pain and or movement limitations is to strengthen the muscles that externally rotate the humerus and the scapula. Okay, but far too often we see practitioners jumping ahead to these external rotation exercises before appreciating the interactions across the shoulder complex, which involves appreciating the rib cage, scapula, and the entire upper limb. Firstly, what we need to do is we need to appreciate that there's 17 muscles that attach to the scapula, 17 of them. So with 17 muscles, it's going to be very difficult to determine the load capacity of each individual muscle. So what's easier for us is to appreciate the behavior of the joint segment and use that as our guide for treatment and rehab. And secondly, when we talk about shoulder external rotation or shoulder flexion or any kind of shoulder driven movement, it's actually quite a confusing way to describe a complex with many interacting segments. So when people say shoulder external rotation, are they talking about the external rotation of the humerus or the external rotation of the scapula? With shoulder flexion, now, what's the behavior of the humerus? What's the behavior of the scapula? What's the behavior of the rib cage? So it's much, much easier for us to describe the segmental behavior of individual segments and then use that individual behavior to guide what we do from an intervention standpoint. So let's talk about a common presentation that we see clinically, and that's that internal rotation of the scapula where the medial border lifts away from the rib cage, which you might describe as a winging scapula. Now, before we continue, there's absolutely no evidence to support that a isolated joint segmental behavior is connected to a pain experience. If you have an internal rotation of the scapula where the medial border is lifted away from the rib cage, it doesn't mean you're going to experience pain. All it tells us is the behavior of that segment within the context of the entire shoulder complex, and that behavior can then guide our rehab. Okay. What's key for us at IKN is looking at that internal rotation of the scapula within the context of the rib cage, the humerus, and the load capacity of the entire upper limb. Oftentimes we'll see the scapular internal rotation present with a thoracic spine that is very extended. Okay, now when we look at this within the context of rib cage and scapular interactions, when I extend my rib cage, that's naturally going to couple with the scapula externally rotating and retracting, and when I flex my rib cage, that's naturally going to couple with that internal rotation and protraction of the scapula. Okay, so we need to ask ourselves the question, perhaps why is that scapula internally rotating more so on that side? So one of the key reasons that we see clinically, and this can really help to guide treatment and rehab, it involves appreciating that scapular behavior within the context of the load capacity and movement capacity of the upper limb. So in order to reach the upper limb in front of us and engage the upper limb to manage load distally at the hand proximally, we need that scapula to protract and internally rotate. But, and this is key, if the rib cage can flex slightly to help facilitate that scapular internal rotation and protraction, then perhaps the scapula will have to internally rotate a little more so, giving that presentation of a winged scapula, okay, to help facilitate that movement of the upper limb in front of us. Okay, so this isn't the case of just a weak external rotator muscle group, but this is potentially secondary to a lack of distribution of movement across the rib cage scapula to facilitate appropriate upper limb behavior. Okay, so really, really important to consider that not necessarily excessive, but a concentration of internal rotation may be needed at the scapula to facilitate that reach forward of the upper limb if we're not getting contribution from the ribcage movement. So treatment and rehab wise, a key component for us involves restoring that distribution of movement across the ribcage and scapula to facilitate that upper limb movement. And a key part of that involves expressing and restoring that ribcage flexion. Okay, so expressing that ribcage flexion and then trying to maintain that as we build the low capacity throughout the upper limb to manage forces from distal to proximal and proximal to distal.